Welcome to the Vollmer Journey, brought to you by All in Functional Health. I'm Dave-O, David's AI voice for education and optimization, the digital voice of David L. Vollmer Jr. On today's episode, I'll be guiding you through the content while Dave focuses on working with clients and developing new material. The information, the protocols, the strategies, it's all Dave. I'm just here to deliver it. Let's optimize. I've got a lot to share with you today. Well, a lot has happened over the past couple of years. My wife Paige and I have been through some serious health challenges that completely changed how we look at medicine, health, and taking care of ourselves. And through all of that struggle, all that research, all those battles with doctors who didn't want to listen, we came out the other side not just surviving, but thriving. I'm actually so passionate about what we learned that I started a functional health clinic called All in Functional Health. The tagline is Unlock Total Wellness. And that's exactly what we help people do. But we'll talk more about that later. First, I want to tell you why I'm qualified to talk about this stuff. I have a master's degree in biology. I'm all about science, truth, and logic. That's how I approach everything. So when I tell you something on this podcast, I'm not just pulling it out of thin air. I've done the research, I've read the studies, I've tested it on myself, and I'm going to share my sources with you so you can look it up yourself. That's important to me. The purpose of this podcast is simple: to add value to your life. Whether it's health, wellness, mindset, or just practical information that can help you live better, that's what we're going to cover. I'm going to share what Paige and I are doing, what's working, what the science says, and hopefully help you take control of your own health. Because here's the truth that I learned the hard way. If you're relying on the mainstream medical system and the government to keep you healthy, you're in trouble. You have to be your own advocate. So today, I'm going to lay the foundation. I'm going to tell you my story, my heart journey. And then I'm going to tell you Paige's story with cancer. Both of these are powerful examples of what happens when you take responsibility for your health, do the research, and fight for yourself. In future episodes, we'll dive deeper into specific topics, specific therapies, and I'll bring on some experts to talk about the science behind what we do. But you need to hear the stories first to understand why this matters so much to me. All right, let's get into it. December 11th, 2023. That's the day that changed my life. I was at the gym working out with my buddy Tony. I was on the stepper machine, and my heart rate was showing 153 beats per minute. Now, that's not normal for me. I'm usually around 90 to 130 when I'm on the stepper. I felt off. I felt anxious, weird, something I couldn't explain. Tony had his Apple Watch on him, so he let me put it on. And it said I was in AFib, atrial fibrillation. Now, at that point, I didn't really know what AFib was. I'd heard of it, but I always associated it with older people, overweight people, not someone like me who was 48 years old and in good shape. So I rushed to the emergency room. That's what we're taught, right? So I went to the hospital. They checked me out, put me on an EKG, and by that time, I was back in normal sinus rhythm. They ran some blood tests, the basic stuff, a CMP, a CBC with differential, checked my potassium, magnesium, sodium, calcium. Everything came back in range. And that's when I knew this was going to be a struggle. Because they looked at me and said, "You're all good, nothing wrong with you. Follow up with a cardiologist." That visit cost me almost $6,000 to meet my deductible. And all I got was a pat on the back and a referral. Now, here's the thing about me. When someone tells me there's nothing wrong, but I know something is wrong, I don't just accept it. I'm not built that way. The cardiologist appointment was 2 weeks out, right before Christmas, and I wasn't going to just sit around and wait. So I bought a book on Amazon called The AFib Cure. I hate reading, so I got the audiobook too. And what I learned from that book changed everything. It talked about advanced blood testing that most hospitals never do, specifically intracellular electrolyte levels. Let me explain this because it's important. When you go to the hospital and they run a standard blood test, they're looking at what's in your blood. That's extracellular. But here's the thing. Only about 2% of your body's nutrients are in the blood. The rest, 98%, is inside your cells. Your blood is the priority. So if you're deficient somewhere, your body will pull from your cells to keep your blood levels normal. So you can have a blood test that shows perfect potassium levels, but be severely deficient at the cellular level. And that's exactly what was happening to me. When I got the RBC, red blood cell, intracellular testing done, I found out I had an intracellular potassium deficiency. My blood looked fine, but my cells were starving. This is something the medical community just doesn't look at. It's a disgrace, honestly. Just so you know, everyone is mineral deficient in some way, unless they're actively monitoring and supplementing. Our food doesn't have the nutrients it used to. We're depleting electrolytes constantly, and nobody's checking the right levels. And we have been taught that salt is bad. That is one of the biggest lies ever told. So I went to the cardiologist, showed them my research, and you know what they said? Your blood work looks fine. Here's a stress test and an echocardiogram. No interest in the intracellular testing. No interest in finding the root cause. The day after Christmas, I went into AFib again. Went back to the cardiologist, different doctor this time, Dr. Tim Olsina. Within 30 seconds of being on the EKG, I converted back to normal rhythm. But they caught a little bit of the AFib on the reading. So I said to her, hey, I want you to run intracellular potassium, intracellular magnesium, selenium, these tests. And she looked right at me and said, no, David, that's not how this is going to work. You need to take these 3 medications, metoprolol, Eliquis, and another beta blocker. And you need to schedule an ablation surgery. Now, for those who don't know, an ablation is where they stick a catheter up through your groin or your wrist into your heart, and they either freeze or burn parts of your heart muscle to disrupt the electrical pathways that are causing the irregular rhythm. They call it a simple surgery. It's not simple. And here's the kicker. 95% of the time, it doesn't work long term. You might be fine for a while, but the AFib comes back. Why? Because they never address the root cause. This is the problem with mainstream medicine. They don't look at root causes. I looked at Dr. Tim Olsina and asked if the pharmaceutical companies had their hands so far up her ass that it was controlling her mouth and brain. She told me it was time to leave. I said, you're right. Fired her on the spot and walked out. The nurses looked at me with sympathy. They see this every day and can't do anything about it. At this point, when I got home, I did call her supervisor and complained to Burke's Cardiology, and then they gave me a scheduled appointment with an electrophysiologist named Dr. Bogata on Monday, January 29th, 2024. Now here's where it gets interesting. January 11th, 2024. I went into AFib again after a long, exhausting physical day before. I was sitting on the couch, feeling terrible. AFib is my kryptonite. It completely sets me back. And Paige posted my symptoms on a naturopathic forum she follows. A naturopathic doctor responded and said, sounds like he's low in potassium. Have him take a couple thousand milligrams. So I went to my cupboard, looked at my potassium supplement. It was 99 milligrams per tablet. You need 4,500 milligrams of potassium every day if you're active. I was taking almost nothing. So I took 20 of those tablets, about 2,000 milligrams, sat down, drank some water. 20 minutes later, I was out of AFib. And that was the last time I had AFib from a deficiency. I wasn't deficient in metoprolol. I wasn't deficient in Eliquis. I was not deficient in an ablation surgery. I was deficient in an electrolyte that my body needed to function properly. But the story doesn't end there. During all this testing, I had a stress test that showed something called ischemia. Basically, something was preventing oxygen from getting through my heart properly. They thought it might be plaque buildup. I found a functional medicine doctor named Dr. Buddy Tuchinski up in Orwigsburg, Pennsylvania. Great guy, thinks outside the box. He suggested I get a CT angiogram with a calcium score. Not just a calcium score as the cardiologist ordered. So I called around, found St. Luke's Hospital, and got it done for $612 out of pocket, compared to $7,000 through insurance. Crazy how that works. The results came back. Calcium score of 0, no plaque. At almost 50 years old, I had 0 plaque build up in my arteries. I credit that to taking vitamin K2 and D3 for the past 10 years. K2 directs calcium in your blood, tells it whether to deposit in your arteries or go into your bones where it belongs. I had been taking 45 milligrams of K2 MK4 every day, and it worked. I'm living proof. But the CT angiogram showed something else, a myocardial bridge. This is when the heart muscle grows over top of an artery. In my case, my LAD artery. So instead of the artery laying on top of the heart, part of it tunnels through the muscle. Every time my heart beats, it squeezes that artery shut. The doctors told me this was no big deal. They are benign. I wanted to learn more about bridges. I found a podcast called My Imperfect Heart, hosted by a guy named Jeff Holman, who also has a myocardial bridge. I listened to all 26 episodes. The stories sounded like me, things I'd experienced my whole life, but never had an explanation for. I reached out to Jeff, and he became a great resource. There's also a group on Facebook and a website about all things myocardial bridges. After digesting all this information, I knew I had to get this fixed as if I did not. And as I age, someday I will get myocardial spasms, and that will cause my heart muscle to squeeze the LAD closed and kill me. So using the information from the My Imperfect Heart podcast and the Myocardial Bridge website, I gathered a list of doctors to call. I called 13 different doctors across the country and world: Stanford, Mayo Clinic, Cleveland Clinic. 10 out of 13 wanted to put me on drugs, a beta blocker for a mechanical problem. That's like putting fuel stabilizer in your gas tank to fix a flat tire. It makes no sense. Eventually, I narrowed it down to Dr. Bonatti at UPMC in Pittsburgh. He's one of the best robotic cardiac surgeons in the world, done thousands of surgeries. His team was incredible. They accommodated my specific requests, including making sure I had unvaccinated blood available for transfusion if needed. That mattered to me. I also told him I would not do drugs after surgery, and we set some guidelines that we'd both be happy with. He also agreed to record the procedure and agreed to be on the My Imperfect Heart podcast with me and Jeff to help explain robotic surgery to the others who listen to the podcast. Before surgery, I had a heart catheterization with Dr. Fowler, Dr. Bonatti's interventional cardiologist. This guy is brilliant and has no ego. He also agreed to be on the podcast and document records and talk about my cath. After meeting with me the morning of the cath, he actually called Dr. Shaw at Yale the morning of my procedure to confirm the best order for the tests, then ended up changing the order so not to get a false positive. When a doctor does that, reaches out to colleagues to make sure they're doing right by you, that tells you everything you need to know about their character. So I was awake the entire time. They did the heart cath. It was pretty wild, seeing inside my heart. The testing confirmed the bridge was significant. At rest, my blood flow was 0.91 above and below the bridge. But at 130 beats per minute, it dropped to 0.59 below the bridge. That's a massive reduction. Most people would pass out. But my body had adapted over my lifetime. My venous oxygen saturation was at 81%, higher than Dr. Fowler had ever seen, even in professional athletes. My body learned to carry more oxygen to compensate. On September 18th, 2024, I had the unroofing surgery. They went in robotically, stopped my heart for about an hour and a half, and cut the muscle tissue that was compressing my artery with a little pair of scissors. I was in surgery for 6.5 hours on the table. I did suffer from some post-op AFib due to some electrolyte imbalances. I ended up needing a cardioversion, as I could not get out of A-flutter on my own. I had to meet with another cardiologist at Burke's Cardiology, and his name was Dr. Salha. Real douchebag. He walked in and asked me why I was there. I said, "I need a cardioversion. Please sign the paper." He was looking at my chart and said, "You need to go on a statin." And I said, "Doc, I did not ask you about a statin. I need you to sign the paper for a cardioversion." He then said, "Your cholesterol is high. You have blocked arteries. You are going to die. You need a statin." Then I said, "Doc, I had 2 heart caths and a CTA, and I have no blockages or plaque buildup, so I don't need a statin." He then said, "If you don't take this statin, you'll get plaque and die." I then said, "I don't care, and I am fine." Then for some reason, he then said, "Here is your paper, and I don't know what else you want me to do." And then I said, "I would like you to tell me why my intracellular potassium levels are low when I take a bunch of potassium." And then he said, "How you expect me to do that? I need to see 60 more patients today." And then he got up and walked out. The cardioversion worked. Then I found an herbal tea called Wengson Granules that acts like a natural calcium channel blocker. That helped me manage the post-operative AFib episodes. As of today, I feel amazing. No more getting winded. No more chest pain, no more heart problems. It took almost a year to fully heal, but I'm back to 100%. The surgery was worth it. Finding doctors who actually listened and cared was worth it. Taking responsibility for my own health instead of blindly following doctors who just wanted to prescribe drugs, that was worth it. Now let me tell you about Paige's journey, because this is equally important. While all my heart stuff was happening, I had started getting into red light therapy and PEMF mats, things I learned about from Gary Brecka and the Superhuman protocol. I found a red light therapy bed on Facebook Marketplace and a hyperbaric chamber, and we started using them at home. Mid-January 2024, Paige was laying in the red light bed and felt a lump in her breast. She went to her gynecologist, got a mammogram and sonogram, then a biopsy. On January 24th, 2024, at 9:15 p.m., we got the information from my chart. Triple negative, invasive ductal carcinoma, Nottingham grade 3. That's an aggressive form of breast cancer. Now here's where everything I'd learned about being your own advocate kicked in. By 9:41 p.m., I had texted Dr. Buddy Tachinsky, the functional medicine doctor I mentioned earlier. He responded within 30 minutes with contact information for Dr. Robinson, an oncologist out of Chicago, who doesn't practice mainstream medicine. He uses naturopathic and functional approaches that actually work with your body instead of destroying it. I emailed Dr. Robinson at 10 p.m. By 11 p.m., he was responding. We went back and forth until 3:30 in the morning. And by the time we finished, we had a plan. A meeting was set for Monday. Time is critical with cancer. You can't wait around for the mainstream medical system to slowly get you scheduled. We took immediate action. I did a ton of research on scientifically backed cancer treatments. Not snake oil, not unproven remedies, actual studies, trials on mice, humans, peer-reviewed research. We started implementing everything right away. First, the basics, PEMF, to polarize blood cells and increase surface area, followed by either HBOT, exercise with oxygen therapy, HBOT, hyperbaric oxygen therapy, to super oxygenate the blood, then red light therapy, to push that oxygen into the mitochondria. This is the Superhuman protocol, and it creates an environment where cancer struggles to survive. Cancer can't thrive in an oxygen-rich environment. We got a 3 ATA hard shell hyperbaric chamber. That's 3 times atmospheric pressure. Paige would do 90-minute sessions breathing 96% oxygen at 2.4 ATA plus. We did hydrogen therapy, inhalation, ingestion, and baths. We did cold plunging at 50 to 58 degrees. Cancer cells hate cold. It releases brown fat and cold shock proteins that attack them. But one of the most impactful things we found was deuterium-depleted water. Normal water has about 150 parts per million of deuterium. The water Paige started drinking was 10 or 18 parts per million. I spoke directly with Dr. Gabor Somliai, who wrote the book on this, Deuterium Depletion, The Cure for Cancer. He's been researching it for 40 years out of Budapest, Hungary. When you lower deuterium levels in your body through depleted water and low deuterium foods, cancer cells shrink. About 8 days in, Paige said to me, "Dave, this tumor feels like it's getting bigger." And that's exactly what Dr. Somliai told me would happen. The tumor wasn't growing, it was swelling as the body reacted to the tumor shrinking and releasing from the cell walls. Paige had surgery on February 15th, 2024, just 2 weeks after diagnosis. The surgeon, Dr. Brown, came out and said the tumor came right out like picking a grape off a vine. Clean margins, sentinel lymph nodes clear, all negative for malignancy. When I told Dr. Brown that Paige had been drinking deuterium-depleted water, and that's why everything went so smoothly, he looked at me for a moment, rolled his eyes, and then turned and wailed away. That's the mainstream medical response to anything outside their training. After surgery, we continued aggressive maintenance, Mistletoe therapy, an injection therapy that works with your natural killer cells. Think of your NK cells as ninjas that go out and kill cancer cells one at a time. Mistletoe gives them a machine gun instead of a knife. Studies show it increases survivability by 40% with no side effects. Paige's NK cells were low, around 131 when they should be 300, 400. So she started thymosin alpha-1 injections, a peptide that raises NK cell levels. She did hyperthermic treatments, a machine that heats the tumor area to about 108 degrees, stressing cancer cells and triggering the body to send oxygenated, nutrient-rich blood to fight them. She completely changed her diet. No processed food, organic everything. Minimum 5.5 ounces of cooked meat per meal, high healthy fats, low carbs, no sugar. We got comprehensive blood testing, intercellular amino acids, RBC potassium and magnesium, heavy metal toxicity panels, and supplemented based on what her body actually needed, not just generic recommendations. And we started using the Signatera blood test, a test that can detect as few as 10 cancer cells compared to 10,000 by other methods. It gives you 4 to 12 months of earlier detection. When I mentioned this to the mainstream doctors, they said, the jury's still out on that. So what? Why wouldn't you use every tool available? Here's the update. Paige's Signatera test as of December 2025 came back 0. No detectable cancer cells. She's been clear since the surgery. No chemo, no radiation, clean margins, clear lymph nodes, and maintaining with natural protocols. Meanwhile, 45 days after diagnosis, the mainstream medical team finally wanted to introduce us to their team. We told them we already had one. Dr. Robinson was with us the night she was diagnosed. That's the difference between taking action and waiting for the system to work. And here's what really gets me. Not one mainstream doctor told us to change our diet. Not one told us about any of these therapies. Not one suggested anything other than their standard protocol of cut, poison, and burn. That's surgery, chemo, and radiation. And when we got good results another way, they didn't want to hear about it. So what did we learn from all of this? First, and most important, you have to be your own advocate. Pull your head out and take responsibility for your health. Stop agreeing with everything doctors say. Stop blindly following the government's recommendations. Start thinking for yourself and looking at the big picture. Doctors today have 15 minutes to see you. That's it. Nobody can diagnose and fix a complex health problem in 15 minutes. They're incentivized to prescribe, not to cure. They've got pharmaceutical reps taking them to dinner, catering lunch to their staff, funding their practices. Nobody wants to upset that relationship. I've talked to cardiologists who became friends with me, and they admit it. Dave, you look at things so differently, but we can't even talk about this stuff. If we do, we'll get fired, and we have 2-year non-competes. We've got kids in college. I can't fault them for protecting their families, but I can tell you the system is broken. Second lesson, find the root cause. Don't just treat symptoms. When I went in with AFib, they wanted to give me drugs and burn out parts of my heart. They never asked about my diet, whether I worked out, what supplements I took, nothing. Just take these pills and schedule surgery. The root cause of my AFib was an intracellular potassium deficiency. 20 minutes after taking adequate potassium, I was out of AFib. No drugs, no surgery, just giving my body what it actually needed. Same with my myocardial bridge. That was a mechanical problem that needed a mechanical solution. Beta blockers don't fix a structural defect. I needed surgery. And once I found the right surgeon who understood the problem, we fixed it properly. With Paige's cancer, we asked, why is this happening? What's causing it? Her NK cells were low, so we addressed that. We reduced inflammation through diet. We created an environment hostile to cancer cells through oxygenation. We didn't just cut it out and hope for the best. We addressed the conditions that allowed it to develop. Third lesson, our food supply is toxic. Why do you think cancer rates keep rising? Why do we have so many autoimmune problems? It's the food we eat and the vaccines. Here's an example that drives me crazy. Fruit Loops. The version sold in the UK and Canada is different from what's sold in the United States. The US version is banned in those countries because of the dyes and synthetic ingredients. They are known carcinogens. You can look up red dye, blue dye, all of them. See what happens when they inject them into rats. They cause cancer. So why would you give that to your children? Why would you eat food that's banned everywhere else in the world except here? Wake up, America. Read the labels. Eat real food. Grass-fed, organic, pasture-raised. Yes, it costs more, but so does cancer treatment. Fourth lesson, get genetic testing. Paige and I both have the MTHFR gene mutation. Methylene tetra, hydrofolate, reductase. That's a mouthful. This means we can't properly convert folic acid or folate into methylfolate efficiently. Folic acid is a synthetic form that's been added to grains, cereals, breads, and pastas since the 80s. If you have this mutation, folic acid binds to your receptors but doesn't convert. You become methylfolate deficient, which affects the methylation process of your B vitamins. The result, ADD, depression, and exacerbated autoimmune responses. Millions of people are affected by this and have no idea. Get tested. Know your genetics. Supplement accordingly. It's not hard, but your regular doctor isn't going to tell you about it. Fifth lesson, get the right tests. Standard blood panels miss almost everything important. You need intracellular testing for minerals. You need to check homocysteine, hemoglobin A1C, advanced lipid panels, thyroid panels, all the vitamins such as A, D, E, K, all the B vitamins, CoQ10, selenium, copper, zinc, omegas, insulin, aldosterone. You need to know what's actually happening inside your body, not just what's floating in your blood. In future episodes, I'll share exactly what tests to ask for and why. I'll share my results, Paige's results, and show you how we use that data to fix our problems. Everything Paige and I went through led me to start All in Functional Health. Our tagline is Unlock Total Wellness, and that's exactly what we help people do. We take a different approach than mainstream medicine. We look at the root cause. We do comprehensive testing. We look at nutrition, supplementation, lifestyle, the whole picture. We don't have 15 minutes to see you and push you out the door. We actually work with you to figure out what's wrong and how to fix it. A lot of the therapies we talked about today, red light, PEMF, hyperbaric oxygen, HBOT, hydrogen therapy. These are things we offer and can help guide you through. We also do the advanced blood testing, genetic testing, and build personalized protocols based on your specific needs. If you're dealing with a chronic condition, heart issues, autoimmune problems, cancer, whatever it is, and you're frustrated with getting nowhere with mainstream doctors, reach out. We're here to help. I've been through it. Paige has been through it. We know what works because we've lived it. So that's the foundation. That's our story. But this is just the beginning. In upcoming episodes, I'm going to dive deep into specific topics. I want to do full episodes on potassium and electrolyte balance, on the myocardial bridge, what it is, how to get it diagnosed, what your options are. I want to bring on Dr. Bonatti, Dr. Fowler, Jeff Holman from My Imperfect Heart, and others who were part of my journey. I will be bringing on other experts who have helped Paige and I on our journey. I'm going to talk about the Superhuman protocol, PEMF, red light, hyperbaric, HBOT. I'll explain the science, show you the equipment we use, and help you understand how to implement it yourself. We'll cover nutrition, supplementation, the toxins in our food supply, how to read labels, how to source clean food. We'll talk about genetic testing and what to do with the results. And I'm going to keep calling out the broken medical system, not because I hate doctors. There are good ones out there, and acute care is where medicine actually shines, but because the chronic disease model is killing people. It's designed to manage illness, not cure it, and that needs to change. Here's my challenge to you. Take responsibility for your health. Don't wait until something goes wrong. Get tested. Know your numbers. Clean up your diet. Move your body. And if something is wrong, don't just accept the first answer a doctor gives you. Question everything. Do your own research. Find practitioners who will actually listen to you. I'm not saying don't trust doctors at all. I'm saying verify. I'm saying advocate for yourself. I'm saying don't be a passive participant in your own health. This is your life. Take ownership of it. Every episode going forward will include resources, PDFs, links to studies, source material. I want you to see where I'm getting my information. I want you to be able to look it up yourself. Question me too. If I say something that doesn't make sense, call me out. I'm about truth, logic, and science, and I can back up everything I talk about. Thank you for listening to the Vollmer journey. This is just the start. Paige and I are proof that you can take on the medical system, do things differently, and come out healthier on the other side. If we can do it, so can you. Until next time, unlock total wellness. Take care of yourselves, and we'll talk soon. That's a wrap on today's episode of the Vollmer journey. I'm Davo, David's AI voice for education and optimization. If you found value in this, share it with someone who needs to hear it. And if you're ready to take the next step in your health journey, head over to All in Functional Health to learn more about working with Dave directly. Until next time, stay optimized.